This is being recorded. And good morning. I'm Brianna Carr. I'm the Marketing Manager and Events Coordinator here at Morefield. And I'd like to welcome you and thank you for joining us today as we discuss the connected resident and what that means for preparing your network. Before I introduce our speaker, a few housekeeping items to go through. Attendees listening in are muted, but are encouraged to ask questions by typing the questions in the chat area on the control panel. And we'll answer all questions after the presentation. We'll also be recording the session, as I mentioned, and we'll make it available to all attendees. I'm excited to announce that we just launched our new logo and website this week. So you'll notice that we have a new look and some new exciting branding rolling out throughout the next few weeks. Our presenter today is Jonathan Mifflin. Many of you probably know Jonathan. He presented at this year's Leading Age Conference just last month. He's our Cloud Carrier Services team lead and is celebrating 25 years with Morefield this year. And I'll go ahead and say he's a pretty nice guy to work with. And with that, I'll hand it over to you, Jonathan.
All right. Thank you, Brianna. Appreciate that. And good morning, everybody. Thank you for joining today. And as Brianna said, we're going to be talking a little bit about preparing for a connected resident. And we shared this session, this was session 50A from Leading Age of Pennsylvania earlier in June. If you were able to attend, or if you were not able to attend, this is pretty much the same content that we went through for that group. Had probably 25 to 30 people in the room, was well received, and a good session overall. So we thought it appropriate to provide the opportunity to run through that material again and have it available to other clients who might be looking at these same challenges for their facilities. And the basis of this was preparing for residents in a different capacity, right? So residents today are more, may not be bringing devices with them to the communities, but as we evolve on, and as we look ahead to the future, the expectation is that more residents will be bringing devices with them when they sign up or join the retirement community. And largely, a lot of this is from our growing dependency on Wi-Fi. And I put this slide together when I was preparing for this presentation, and just think of the number of personal devices that we all have in our lives today. Our smartphones, our watches. I think the AirPods are still one of Apple's top sale producers. So AirPods are flying off the shelf. And think about the number of devices that you have at your house. When I was working on this presentation, I looked at our router that we have that connects everything in our house, and it's just my wife and I, just two of us. But I think I counted 25 devices that we have connected on our network, and those devices are laptops, tablets, Fire Sticks, smart outlets, our thermostat, garage door openers, and all those devices. The way they connect within our home is all wireless, right? So none of this stuff is wired anymore. It all connects wirelessly through our Wi-Fi in our houses. And these devices, because they all connect Wi-Fi and because they're not wired, they're mobile. So if my wife and I sell our house and we move to a retirement community or we move to another home, we can just pack all of our devices up and take them with us to our next residence. And they are mobile in the way too that the applications that they operate on the right hand side of the slide there are all cloud-based, right? So these are all subscription services. These should look familiar. The Netflix, the Hulus, the Disney Plus, cloud applications, social media sites like Pinterest, Facebook, Instagram. All of those are delivered via the cloud over the network. And one thing that we saw from our clients, looking at pre-pandemic and post-pandemic, as we all worked from our homes and spent a lot more time in our homes during the pandemic, we found that we used more of these devices. We used more of these subscription services. And as we started to return to the office, we found that there was a little bit of a disconnect, right? So traditionally, networks in offices and office buildings in retirement communities are built to accommodate wired devices. Wireless is more thought of as a technology of convenience. It's there. It might be in a conference room like I'm sitting in today. It might be in a lobby. It might be in a break room where employees are hanging out. But for the most part, wireless is not thought of as a core technology to support the applications and employees and or residents within a facility. The wired network is thought of having more of that capacity to support the applications, employees, and residents. Well, going forward, I would, a lot of this premise for this presentation is that we're expecting that to shift. There will be less emphasis on wired connectivity and more emphasis on wireless connectivity. And it's that shift from creating a wired network that has lots of capacity to a wireless network that has the same and or more capacity is something that we all need to be thinking of in our 3 to 5, 7-year plans looking out. So core to that is connecting to the internet. And so as I mentioned, all these devices rely on the internet to connect. And you need to have internet connectivity at your facility. But just as wireless isn't always thought of as strategic to the operation, it was more of a technology of convenience. In some ways, the internet was the same thing. And to that, I could say that most organizations that we work with today and most organizations in central Pennsylvania rely on a coax cable modem. And I would say that those of you joining today and those of you attending today, whether it's at your house and or your place of business and or your retirement community, likely have a coax cable modem that is providing the internet service for your facility. And it's because this is probably the most popular infrastructure throughout Pennsylvania. It's existing. It was built and designed to support the television network, and they've just retrofitted it to also provide internet access. So it's inexpensive. It's very available. It supports both businesses and residents, although those customers are segmented. Whoop, I don't know why it advanced there on me. And it can provide speeds up to 1 gigabit and is also very affordable. Most plans start at $95 a month and then can go up from there. One thing I will share with you is most, and we talked about this during the live session at Leading Edge, the average coax contract for your cable modem service is 24 months. That's what we see from most of the providers throughout Pennsylvania, is they provide a 24-month agreement. When that agreement expires, those contracts typically are set to auto-renew, and they auto-renew for 12-month periods. So if you're not looking at your coax contract every couple of years, it's very likely that your contract has expired, you've gone into a 12-month auto-renew, and there may be other promotions that are available that could provide you more bandwidth for about the same price. I see this all the time with our clients is they look at their cable bill, we look at what they're spending today, and if we go back to their provider, more times than not, we can get more bandwidth for about the same money they're spending today when they were in their old contract if they sign up for a new contract. So as a takeaway or action item from today's webinar, if you haven't looked at your coax contract in a while, take a look at it, see what you're spending today, reach out to your provider, and there may be opportunity to get more bandwidth for about the same amount that you're spending today. There are downsides to coax. It is the most popular service. Everybody's using it. But just because something is the most popular doesn't always mean it's the best. Probably the biggest challenge with coax is, and cable modems is that they are asynchronous. So they are built to accommodate how we traditionally browse the internet. We type a little bit of text into Google, it sends it up to the internet, and then a page loads and comes down with all the pictures, text, videos, what have you that come down as that page opens. So it's an asynchronous. There's less bandwidth going up than there is bandwidth coming down. And it works great for browsing the internet. But if you want to make a telephone call across that, where you need just as much bandwidth going up as you do coming down, if you want to stream a movie or television show, same thing applies. If you want to transfer a file, if you have some photos you want to send somebody or transfer up to a cloud drive like a Dropbox or Google Drive, you need just as much bandwidth going up as you do going down. So while this is available and it's affordable, there are downsides to coax that you should consider as you begin to look at how you need to accommodate the employees and the residents of tomorrow. And that's where we see a lot of businesses starting to consider fiber optics. And fiber optics, the industry term is direct internet access. That's the acronym up there in the upper right-hand corner, DIA. These services, the pricing of these services continues to come down and down and down as more and more fiber is installed throughout Pennsylvania. And this service is becoming more accessible to more organizations. Its pricing is starting around $500 a month. This service is symmetrical, so you get just as much bandwidth going up as you do coming down. So if a provider is offering you 100 meg bandwidth, you get 100 meg upstream and you get 100 meg download as well. These services are all premium services. They carry a SLA or service level agreement that if the provider needs to upgrade the circuit, if the provider needs to take the circuit down for maintenance, you are notified. And or if the circuit, something happens to the circuit and it breaks, these services get priority in terms of being restored over services like coax or cable modem. These circuits are also monitored by Network Operations Center, the NOC. And so, 24/7, you have eyes on these circuits to make sure they're operating and ensuring that they're operating at their peak performance. So the downside to a service like this, while everybody isn't switching over to fiber, is it's all based on location, 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 as I say down there in the right-hand corner. So the map you see here, the slide that you're looking at, is an actual provider's network. And the purple lines that go throughout Pennsylvania are the fiber that they have in place. So where there is a purple line, and if your facility is within, usually the rule of thumb is 500 feet of a purple line, then you can provide, then the provider will build out the fiber optics for you without any out of cost from your pocket, no out of cost costs. If you're outside of 500 feet, more times than not, they will pass on the opportunity because it's just too expensive and too cost prohibitive, too much of a construction project to get fiber optics to your facility versus looking at somebody else who's closer to their network. These maps are constantly changing. They're constantly evolving as they build these networks out more and more and more. And organizations like ours, like Morefield, we have access to tools, and all we need is your address. If you send us your address, we can pop your address into the tool, and within a few minutes, it'll tell us whether your facility is accessible to fiber optics and who the provider is, and or if your facility is not accessible to fiber optics. So again, if you're looking at having another connection or another option to coax, as a takeaway for today, reach out to somebody at Morefield, provide them your address, and we can run it through our system and provide you a report that shows where your facility is and if your facility is accessible to fiber optics. Of course, being in central Pennsylvania, we still do have our challenges. And while fiber and coax are across a predominant amount of the state, there's still a lot of areas of the state that have no internet access, and that's where we rely on wireless. And there's two means of wireless. One is LTE, and LTE is rapidly growing to accommodate rural Pennsylvania. They're as part of the federal infrastructure bill that was passed and the money from the federal government that went out to build accommodate infrastructure, a lot of that money is being tagged or earmarked to put up towers in rural parts of areas like Pennsylvania to provide wireless coverage to those facilities. So a lot of municipalities and other not-for-profits are taking on this challenge of building these towers to increase our coverage and increase the availability of the internet across Pennsylvania. So that might be an option for you as well. These plans are typically affordable. They start around $70 a month. The downside of these plans, a lot of times, because they are cellular and they're relying on LTE towers, a lot of them come with data plans. So they're not unlimited data. You only get a certain amount of data to use with your monthly subscription. So more times than not, we see these plans used as a backup. So maybe you have coax as your primary, and then the LTE would be your backup. So if the coax goes down, you still have internet access for your LTE. The other option below is satellite. That has a coverage of 97% throughout Pennsylvania. As long as you have line of sight to the southern sky, you can more times than not get a satellite connection, a SATCOM connection. These are communication satellites that are way up 700, 800 miles up in space and are providing TV signals, internet signals, telephone signals. They will not support real-time applications, but they will provide internet access to just about anywhere within Pennsylvania. So again, as a backup, it's a good connection to have as a secondary connection to maybe your coax and or fiber. And that's what we recommend to a lot of our clients today. Because there are so many options available, coax, fiber, LTE wireless, satellite wireless, is more times than not, we are recommending that our clients consider having 2 connections versus 1. Because again, as we went back to the first slide, so many of our services are being provided as subscriptions from the cloud. We see lots of commercials about cloud. I'm sure there's lots of your application providers, your healthcare application providers, other providers that you work with, other vendors you work with, that are recommending you're going from your on-prem servers up to cloud. Go to a hosted server, an offsite server, a data center. All of that relies on the internet to provide that application from a server on your facility to a server in the cloud. And that's where if your server is now in the cloud or the application is coming out of the cloud, having 2 connections is better than having 1. And this is kind of the optimum approach here. This isn't always available to everybody, but the optimum approach is to have 2 providers, 2 different paths, and 2 different technologies. So maybe it's coax and fiber from 2 different companies, and they take 2 different paths to get to your facility. But again, this isn't always the optimum way to connect and or available to everybody just because of different providers and what they have that's available in central Pennsylvania. Last comment on this before we switch over to the next phase of the presentation is there are folks out there that will label this SD-WAN, and SD-WAN is another technology. What we call this at Morefield, this is internet redundancy. And SD-WAN is a technology that a lot of organizations are taking advantage of, and there are a lot of benefits to SD-WAN. But if you're working with a provider, it's just important to understand, are you talking about SD-WAN or are you talking about internet redundancy? Because while everybody needs and can use internet redundancy, not everybody needs SD-WAN. And so it's important to distinguish those 2 so you find out if you're not paying for something like SD-WAN that you don't necessarily need and you can get by with internet redundancy. So we'll shift the presentation now to inside the facility. So to this point, we were talking about how do we connect the campus, the facility, the building out to the internet. So now let's talk about once the internet traffic and bandwidth gets into the facility, how do we connect and what do we do within the facility to accommodate this increase of devices? And Wi-Fi within healthcare and within retirement communities has always been core to the operation. And largely that's because these facilities have always been very mobile. The workforces are very mobile. People are on their feet, employees are on their feet, walking the facilities, and as well as residents. Residents are going from room to room. They might be going from their apartment to the dining hall. They might be going to an activity. And so everybody in these facilities is always on their feet. And so it lends to being a very mobile environment. And we see those with different things such as resident engagement, entertainment. We talked about where they might be using their tablet to stream a TV show or a movie. They might be talking to a family or friend. We might also have sensors throughout the facilities to monitor doors that are opening or lights that are on or thermostats for HVAC systems. And then our medical records that we're relying on to track patient care. Those applications more times than not are coming from cloud service through the cloud, a hosted data center, and are being broadcast into a laptop, a tablet, maybe a smartphone. And so we're looking for that instant communication to provide between the caregivers, the medical records, and also including the residents in these discussions as well. And so as you begin to design for Wi-Fi, there's some points that you need to consider. And again, think of this as what you're going to need for tomorrow, looking at what your current capabilities are with your Wi-Fi network today. And do you have, is your Wi-Fi built more as a technology of convenience? So you maybe have access points in conference rooms or outside the nurse's station, or maybe in break areas, or do you have access points distributed throughout the facility so it can provide wall-to-wall coverage with a high density, a high amount of devices? And then what are the priorities? What applications, likely that healthcare records are probably a priority over somebody on social media, or a resident on social media versus an employee trying to access a healthcare record. What applications, what are applications will you need to support from the operation of the facility, and what applications will your residents be looking forward to access for entertainment, talking to family, friends, and or using their device and or subscription services that they may have and may want to use while they're staying at your facility. And then also thinking about what are those devices. The very first slide that I went over in the presentation rattled off, all different types of devices. And every day there's more and more devices that are coming. And those devices, when they're introduced into the marketplace, more times than not are wireless. They're not wired devices. So thinking about what are those devices? What are if I walk around a resident's room or I walk around a resident's apartment, what are all the devices that they're plugging in? What are all the devices that they're expecting to use within the facility? And then think of, from the employee standpoint, when an employee comes to work today, what device are they logging into? What device are they relying on to do their job throughout the day? And what other devices are they going to also need access to in order to complete their job functions for the day? And then just broadly, how many devices against the people? I mean, I think I think from older statistic was each person has 3 to 5 personal devices, wireless personal devices on them. That number's probably gone up. That number will probably continue to go up. But just looking at how many employees you have on a given floor, within a given building, within an apartment or within a facility, and then also how many people are in there to start to begin the scale of how many devices are you going to need for the facility. And then, largely the old way that we used to design Wi-Fi is we would take a blueprint, a floor plan like you see there, and most access points have a given radius of how far that radio signal will carry throughout the facility. So it's just, taking a cup, turning it upside down, drawing your crayons out there, and filling out where you think the best position for the access points will be to provide optimum coverage for employees and residents throughout the facility. The cups and crayons, though, I would say that's probably not the more popular method. That's, as Brianna said, I've been with Morefield for 25 years. So early 2000s, that was probably our best way of putting together a Wi-Fi design. Today, more often than not, we're using a predictive model. And the predictive model is taking that same blueprint, uploading it into a computer, and then we're drawing the walls and telling the computer what a wall is. This is a dry wall. This is a concrete block wall. This is a cubicle wall. And then once we fill all the walls in, the computer could then accurately tell us where the access points need to be and what type of coverage we should expect to get from those access points when they're installed. And so that is probably the more popular way for us to design a wireless network today that is more accurate than the cups and crayons method that we had 15, 20 years ago. And then also, though, cuts down on the amount of labor required to put together a Wi-Fi survey for an organization. There are also ways to do passive Wi-Fi. So that's where we use models, again, to predict, and we're actually coming on site though, but then we can use models to predict where those access points would be. And then finally, the one that we can use as well if we want to do some modeling before we maybe do a full-blown Wi-Fi deployment, we want to take that predictive model and test it. We can bring an active access point out on site, install it, and then again, walk around the facility to see if what the measurements we were predicting from the predictive model are actually reading through on the active model. So one or all 3 of these are often used in deployment today to build out a new Wi-Fi network for an organization. And then, of course, as with anything, security needs to be top of mind with this. Wi-Fi as a technology, not only does it reside, that signal, you think of that Wi-Fi signal, it's throughout your building. If you have a campus, it's likely throughout your campus. But that also means that signal can be seen by and potentially accessed by folks that are beyond your facility and outside of your facility. Probably the first thing though with security is physically securing your access points. You want to make sure that the access points, somebody doesn't potentially steal one and or gain access to one and turn it into a rogue access point and use it to gain access to people's devices on the network and or your employees' devices on the network by compromising that access point. So physically securing the devices is a recommendation that we usually include with our designs. Separating the wireless network. So while the residents, employees, those are two different user groups, two different user communities. And I would say you might even have a third one. You might have guests and visitors. So you have your residents, your employees, and your guests and visitors. All of those user communities are going to have different needs, different requirements. And you want to make sure that you isolate those, because having a resident be able to access things that are on the corporate network probably isn't a good thing. Vice versa, having a guest be able to access a resident or a resident's device also probably isn't a good thing. So it's just good practice to keep all of those folks isolated. And that's kind of the next bullet here as well, is you want to make sure that everybody is isolated from the different devices that are connecting on the network. Access control, this can be as simple as a password, but more and more the ways that you can provide access control to a Wi-Fi network have greatly evolved. So if you used to have a Wi-Fi key or Wi-Fi, what's your Wi-Fi password? And it was some Wi-Fi password, our facility 2022 or Wi-Fi 2022. More times than not, we're recommending that you tie that access control into an Active Directory server, especially for the employees. And that way, as a new employee starts, that employee, once you're providing them their username and password to get onto the corporate network, that same username and password can also be used to access the Wi-Fi network. And likewise, that technology can also be pushed down into the residents as well. So as a new resident joins the facility or moves into the facility and you're onboarding them, you can provide them a username and password that is unique to them and is only accessible by them and provides them the privacy and something they can use to manage their devices and keeps them isolated from all the other residents and or employees and or visitors and guests. Content filtering and DNS security, this is something else where you want to make sure the service you're providing, there's lots of bad actors on the internet today, as we all know. I don't think there is a day that goes by we don't read about a ransomware event or a ransomware story where somebody clicked on something, their device was compromised, locked, held for ransom. And again, if you're providing a service not only to your employees so they can operate efficiently, but also to your residents, you want to ensure that there's some basic protections in place so that they don't and are not exposed to some of those bad actors that are out on the internet. And there's tools that you can put in place on the network that kind of sit behind the scenes and ensure that traffic that is going to and from the internet is legitimate, is validated, and is secure for your residents, employees, and even guests and visitors coming to the facility. Also, I would pair this up with a acceptable use policy as well. That's always a good practice, not only for the employees, but also for the residents and guests and visitors as well, that they understand that this is what your expectations are for using the internet, how the internet should be used, and what is acceptable internet use versus what is not acceptable internet use. And then we kind of we hit this point earlier with the spoofing and rogue AP detection, but even if you physically secure your access points, you still could have a bad actor potentially sit outside the peripheral of the campus or of the property with a rogue access point and try to make it look like an access point on your network and try to spoof people into connecting to their access point so they can compromise their devices. The wireless networks of today can actually detect those rogue access points when they come online, and they have technologies where they can triangulate where those are and actually block the signal so that the devices that are trying to connect don't try to connect to those rogue access points that are spoofing your legitimate access points on the network. And then if you're not doing this today, or a lot of facilities we're working with, you may not be doing this to scale. You may be doing this for 1 or 2 residents that come into their property and they request internet access. So it's almost a one-off. But again, thinking ahead to the next 3, 5, 7 years, as more and more residents come through the doors and more residents move into the facility, the expectation is that every single one of them is going to want internet access. And so how do you scale this so that you're not overwhelming your IT department or your IT provider with constant onboarding and offboarding of residents? And there's applications you can use out there that streamline this process and allow you to do this process at scale for a large number of residents and provide a secure way of doing it as well. So, some of these tools will set up the resident with their own network, with their own username and password in a quickly efficient way. So it's just a couple keystrokes for the network admin, but then they get a secure network that's isolated from everybody else, their own username and password. And the other benefit here too is if they're roaming throughout the campus and their devices are uniquely tagged to them, maybe they're sitting in the dining hall and they want to print something back in their apartment. They could bring up their device, see their printer, and they could print something back in their apartment without having to walk back to their apartment or without having to worry about the other residents seeing that printer and deciding to print something to their device. So that's an application that is also be considered. Along with that, I would also say you can include help desk as a service. So that's another application that there are companies out there that for a low cost, you can provide basic help desk services, probably not for your employees, but more for the residents. So if they have trouble connecting one of their devices, instead of inundating your staff or your IT department, they can reach out to this company, email this company, and then they will work with the resident on some basic level 1 troubleshooting on connecting their device to your Wi-Fi network. It ensures they have a good experience, they're happy with the service, and they're able to use the service because they have the technical support to get their device connected to the network. So heading into the closing couple slides with the presentation here, and one question that we get a lot with working with our continuing care retirement community clients is, if we do all of this, if we add Wi-Fi, if we enhance our Wi-Fi, if we add a second internet connection, can this be a revenue stream? Can we use this as can we charge for this service? And so just putting in some thoughts here in a couple slides to give you some ideas of that question. Can you turn this into a revenue service? And so first of all, there's the capability of the technology. Can the technology, is it set up, can it be configured to support this as a revenue service? And the simple answer to that question is yes, it can. So the technology today can be configured with splash pages and walled gardens. And you may have seen these when you check into a hotel or you go to a Panera Bread and your device comes online. And before you can connect the network, you get a splash page or a welcome page that says, welcome to the Hilton Wireless Network. Please, read through our acceptable use policy. Click here to connect. If you're a resident, click here. If you're an employee, click here. If you're a guest or visitor, click here. So you can segment all of those. So the technology is equipped to do that. The technology is also equipped, as we mentioned before, to segment the networks so you can keep your residents from your employees, from your visitors and guests. And the basic reasons is you may want to provide different experiences for those folks. So again, the employees may get the high priority in terms of access to bandwidth and to support the applications that they need to operate the facility. And then on your residents side, they may be second in line. They may also have a prioritized access to the internet to support their streaming movies or talking to loved ones and family or using social media. They may have a priority access. And then your guests and visitors may just have a basic access. So you're providing internet access, but you're not charging them for it. So it's just a very basic internet access that they can use to check email while they're at your facility, or maybe to check in on your social media posts. But it's not a premium service, and it's provided as free. So policing and rating of the traffic can all be done through the technology as well. And then lastly, to identify the devices. So the technology today can identify the different types of devices that are connecting, the operating systems that they're using, whether or not the devices have been patched, or whether or not the devices are maybe vulnerable to different security exploits because they have not been patched. And if a device is vulnerable and it hasn't been patched, you can set a policy and say, okay, don't allow this device full internet access, put this over here in quarantine until it gets the necessary security updates, and then allow it to access the internet. So all of those technologies are available within the platforms that we see today. You know, and the justification for providing the internet access. So, you know, if you think about from your facility standpoint, you're providing, and this is going to require capital investment. If the Wi-Fi network today was built as a network of convenience, but needs to be built so it can accommodate more capacity and more devices and real-time applications like video, streaming TV, social media, etc., then there's going to be an investment there required by the facility. So, justifying the return on that investment would also come from charging the residents for those services. And maybe there's tiers of services too. So maybe there's a basic internet access that maybe is included with the residents' fees. And maybe for those residents who want a premium service, there's a additional amount that's charged for those who want a premium service. The help desk as a service, if that's a cost that would be absorbed by the facility, some of those costs and or all those costs could be passed along to the residents, because again, you're providing a service to them. If they need technical support on their tablets, Fire Sticks, PlayStations, devices, etc., they have the means of getting technical support to get those devices fixed so they can get access to the internet. But those costs would be bundled into the cost of their internet access. And then lastly, your workforce efficiencies, happy employees, it's also an outcome you're getting from having a faster network, more bandwidth. Nobody wants to, employees who get frustrated by a page doesn't load, an application that crashes, something that's not working, is frustrating, they can't get their job done. So making the investment in the facility and having higher capacity internet circuits also has the side effect and outcome of providing a better workforce and happier employees. And so that's on the lower part of this slide, we have the free basic Wi-Fi connectivity. These are some points of consideration or maybe some recommendations to think about, takeaways from today. Maybe there's concluding a basic Wi-Fi for residents, visitors. We talked about security a lot today. Security is core to all of this, ensuring that basic security measures are in place to provide a secure environment for the residents and your employees and guests and visitors to use the internet. Offering a higher speed service for residents who want a premium service or more bandwidth than may be offered to your basic residents and or guests or visitors. And then offering the help desk as a service as well to those residents. So last slide here, wrapping up. 5 things that I hope you take away from our time together today, and kind of your call to action or your checklist to consider. 1, in Pennsylvania today, we have numerous technologies for internet access. We talked about having 2 carriers is better than having 1. So if today your facility is relying on a coax cable modem today, maybe take a look at, reach out to sales@morefield.com, provide us your address. We can run a quick check for you and tell you if other services are available in your area. That may be fiber, maybe wireless, maybe satellite, but take the steps to make sure you have internet redundancy as internet service is becoming core to the operation of most facilities. The 3rd point there, Wi-Fi design services. We can provide those as well, and or other companies out there can provide those as well. But those are there to ensure that you have the right network in place, the right equipment in place to provide a technology that's not just convenient, but is there to support all of the applications, all of the devices for your employees, residents, guests, and visitors. 4th point, security has to be included in all of these thoughts. And then finally, by going through these measures and taking this on as a project and taking some of these steps, you're able to promote the facility and differentiate yourself from other facilities by offering these types of premium high-speed internet access services. And then in closing, we included some links here below that not only from our website and some of the blogs and articles that we have on our website, but also from others that have put some thought leadership towards Wi-Fi, internet applications, et cetera, and as they relate to the continuing care and retirement community. So that's my last slide. That's all I have for today. And Brianna, let me turn it back over to you and see if we had any questions. Looks like we have a few minutes left here for a couple questions, if there are any.
Yeah, great. Thanks, Jonathan. Thanks for the presentation. I do have one here. I want to remind everybody that they're welcome to add questions into the chat box that's on the control panel at any time. So the one I have here is preparing for a project like this to upgrade the Wi-Fi or internet access. How much of this is rip and replace versus upgrading what we have today?
That's a good question. And so, yeah, there could be an element of rip and replace, but largely, I think this could be more of an evolution versus a revolution, right? So it's looking at what you have today, either from your internet provider and or looking at what you have for access points. And then largely the newer technology, the newer access points can be used in conjunction with your existing access points to provide different areas of coverage, and or maybe the older access points are repositioned to provide internet coverage or Wi-Fi access in places that maybe there's not as high a density of users, but maybe in more public areas, we're installing new access points to provide high levels of capacity and high levels of bandwidth to where we're going to expect to have larger densities or larger gatherings of employees and residents. And then same with the internet. As we were talking throughout the presentation, if today you have coax internet, we can add on to your fiber optic internet, LTE, satellite, and at the same time, I'd also say probably renegotiate your coax internet to get you a better rate and or more bandwidth there too. So largely, these projects are not disruptive to the organization, but going through these projects generate a better outcome for the organization. So hope that helps to answer that question.
Great, thanks. I have one other that came through. The tools that you referenced in the presentation, how would I get to those tools to check my building's address to see if it's eligible for fiber optic internet access?
Yeah. So those tools, we get that question a lot. A lot of our clients, have the means and like, well, if all you're doing is put an address in, why can't we do that? So the tools are somewhat proprietary to Morefield, and we work with a lot of the carriers throughout Pennsylvania. These are the folks like Comcast, Windstream, Lumen, BreezeLine, and they are providing access to their data and where they have these cable plants and fiber plants built. So it's not something that's readily available to the general public. So again, my recommendation there is if you want us to run an address for you, it takes minutes. Send something either to your Morefield representative and or reach out to us at sales@morefield.com, and we will run your address. And what you get back is actually a nice either 1-page or 2-page report, shows your address and shows all the providers that are within your facility that can provide you access to your facility. And there's no obligation. You're not going to get phone calls or emails from those providers. They frankly don't even know we run your address. So you can look at that. And if you want to do something today, you can do something today. We can work with you to get quotes. If you want to wait and just say, well, we're going to sit on this for a while, we don't want to do anything today, that's fine as well. So there's real no obligation for follow-up or anything if you want us to run your address. It's free, it can be done quickly, and you're not going to be inundated with phone calls and emails if we run your address for your building.
Great. I don't see any other questions. If anybody has any, please, if you think of anything, there's a lot of information to digest, feel free to email us, give us a call, even use our chat session online with any future questions. We're here to help, and we're happy to answer anything that, comes to mind. We understand every organization is unique and different, so feel free to reach out and we can, get a little more specific. On behalf of Morefield, I'd like to thank you for joining us this morning, and I hope you have the wonderful rest of your day. And thank you, Jonathan, for the presentation. And thank you, everyone. Have a nice day.
We'll see you guys. Bye-bye.